Thank you so much again for stepping in. Now I have the privilege of welcoming our first panel of esteemed speakers to the screen, and I will be pleased to moderate this session. The topic they're going to address is the challenges and long-term opportunities, and obviously a lot of this information has come forward in the previous discussions. We'll examine trade strategies, policies, risks and forecasts for the bilateral health sector. So it's my pleasure to introduce David Olsson, the National President of the Australia-China Business Council, Dr. Regina Crameri, Head of the Health Centre of Excellence at Austrade, Dr. Amanda Caples, Victoria's Lead Scientist for the Victorian Government, and welcoming back Anthony Bishop, President, Asia Pacific and Latin America for Cochlear. And if I may address my first question to you, David, as President of ACBC and given our role as the leading organisation in facilitating business and cultural engagements between Australia and China, how do you see a way forward for Australian and Chinese businesses and organisations to maintain strong links with each other given the current geopolitical environment?
Thank you very much, Virginia, and thank you for inviting me onto this panel. And what a terrific session we've had so far. That story about Cochlear is just such an amazing story. And when you hear stories like that and you hear the scale and scope of opportunities that Tom, Jason, Brett have all spoken about, you sort of overlook some of the challenges of maintaining strong dialogues with our colleagues in China. But we can't overlook that right now because they are difficult times. COVID has made it extraordinarily difficult to maintain connections. Without on-the-ground presence and trusted people there, it's very difficult right now for individuals and for companies to maintain those such important relationships. So that at the moment is our great challenge, keeping it going. But I think we need to be very positive about this. And I think the first thing we need if we want to maintain our ongoing connection is confidence. We must have confidence in the future, and there's good reason for that. We've got the most extraordinary range of connections and relationships that have been built up over decades. Individual relationships coming out of just individual travel, personal relationships, people that move between countries. We've got business relationships, deep and abiding business relationships. We've got student relationships, university collaborations, sister city-state relationships. All of those things go to really to form a web of deep and abiding relationships and connections. So that we should have confidence in. It's not going to go away quickly, but we can't take it for granted. And whenever we have an opportunity to reach out and reconnect with our friends and colleagues, we should be doing so. The second bit about confidence, I think, Virginia, is that we should have confidence in our own national ability to be able to face the new realities of the world. Just yesterday, Josh Frydenberg, the Treasurer, was talking about Australia needing new national strategies. That was pretty much directed at China. But the fact is the world is changing so much at the moment. China is at the core of so many things, but deep down we've got things like technology change, we've got managing COVID, we've got geopolitical issues. All of those are there, and we need as a nation strategies to be able to respond to that. And we've got them. We are a resilient nation. We know how to respond, and I think we should have confidence in our own ability, and we should be backing ourselves at all time to get through these difficult times. So that's the first point about confidence. The second one, I think, when we talk about what do we need to do to keep those connections going, we need to try and visualize what a future relationship with China might look like. It is going to be different to what it was in the past. It will be more constrained. It'll be challenged. It'll be difficult at times. And I think we need to develop a whole series of scenarios around what the future might look like. But there are a couple of principles I think we should keep in mind all the time around when we're talking about China. The first is that there is no viable option to continue other than to continued engagement. Both the government, federal government, and the opposition have stated that at our Canberra Networking Day very clearly. Engagement must continue with China. Everybody is talking now about a China Plus strategy. Wherever possible, stay connected to the most important, most valuable market that we have economically with Australia and China, but at the same time look to manage the risks that are around that. And the other point is that we need to recognise that we're moving into a world where there are new strategic realities. China's power, its influence are going to continue. and we just have to keep on finding ways to connect and maintain connections. The Trade Minister generally has been calling for business to step up and engage, and that's exactly what ACBC is doing, whether it's through events like this where we try to reach out to colleagues and in China and those that are engaged in the China ecosphere. But we're also looking through ACBC at all sorts of other platforms, and we're in constant and regular contact with people on the other side, Chinese government, embassies, consulates, to keep those conversations going and to try to find opportunities for us to re-engage when the time is right. So I think, we need to look up, we need to back ourselves in this. It's difficult times, but there are plenty of opportunities out there, and we have the capacity to be able to be successful in a future relationship with China.
Thank you, David. And that gives us a lot of confidence, really good platforms to build on. So thank you for that comprehensive overview. If I could move now to Amanda, Dr. Amanda Caples, our lead scientist. It's often said that science has no borders, and given its role to improve lives and contribute to economies, this is particularly true in health. So could you please discuss some of the key Victorian government initiatives in health sciences that you'd like to highlight to our audience?
Thanks, Virginia, and hello to everyone online, and thank you to the ACBC for your leadership in setting up the session that we have today. So yeah, science has no borders, and I think that is something that we've recognised here in Victoria for a long time. And if I can pick up the remarks that many speakers already today have made, where I see that we have a commonality with our friends in China, and it's around long-term. It's about long-term and developing solutions for our health challenges. And I think that that's something that China is known for. We've heard about the 5-year, 10-year, 50-year plans that are undertaken there, or that are sought to be delivered. And similarly, here in Victoria, we've been at the development of the health and medical research and biotech industry development for a very long time now. And I think the current situation that we find ourselves in around the world underscores the reason why we do what we do, which is about developing, investing in science for the purposes of benefit to humankind, whether it be in health, which is the current priority quite clearly, as well as right across the economy. So when last year I describe as my homework for 2020 is to take a look at particularly the last 20 years where the Victorian government has had a sustained long-term year-on-year commitment to the development of the health and medical research sector. And this report you can find on my webpage. But I think it serves the purpose of giving not only Victorian and Australian researchers and industry an overview of what can be done with constant and consistent policy direction. Also goes to describing the wealth of our system here in the state and how we're ready to engage on the world stage, because you can't build the capability that you need to engage successfully on any basis, let alone an international basis, if you don't have all the pieces in place.
Amanda's just frozen there. We might just give her a minute to see if her link reconnects. Zach, I'm wondering if you can assist in this regard. Otherwise, I may ask the same question of Dr. Regina Crameri while we wait for Amanda's link to come back again. Regina, given your background and current role with Austrade and looking at the investment perspective, again, what are the key government initiatives that you would like to highlight to the audience?
Yeah, thanks, Virginia. And that is my absolute nightmare that's just happened to Amanda with 5 children homeschooling today. So I've got my fingers crossed that I'm going to get through this panel session. Can I just say that the one thing I've always loved about being in health is the great leveler. Regardless of where you are, what time you are, it's the one thing that people need in their lives. And throughout the last 2 years, we've seen some great outcomes in health, trade and investment between Australia and China. So I think it's, we can look forward pretty positively with what the future will hold between the two countries, and Austrade's committed to that. So, for Austrade, can I start with us? I'm going to be a little introspective first, and that is that, we have great, passionate people. We have 12 offices around China. We've got our offices all around Australia with people with all sorts of disciplines and backgrounds that want to ensure we have a smooth pipeline of trade and investment between Australia and China. So for any out there who don't know that are on the call, reach out to your Austrade representative. We really are a fabulous bunch. We do a lot of market intelligence with people in China, particularly they understand, like what Cochlear do, we understand what it takes. We understand what the regulatory environment is. We understand, how to find your partners, how to get the person that can help you do the market assessment for your entry into a new market. And we also provide, obviously, Australian government assistance where we can. So let me take you through a couple of those that have been really critical during the last 2 years. The first program that I'd like to identify for those who don't know about it is the Export Market Development Grants, or EMDG. Now, since July this year, that has changed from a reimbursement type arrangement to a grant program. Some of the great features are still there, but we've tried to make it easier and more seamless for our great companies to join that. So it's a simplified application process. You only need to apply once for either a 2 to 3 year grant, and much better than last time, you actually get to know how much money you get up front rather than a reimbursement and not really sure what the outcome will be. Now, there are 3 tiers for that, so it's there for everybody. We've got the ready to export. So for the first time exporters who are not sure how to get into market, first join your Austrade team member and talk to them, but also there's a grant there for you. We've got the exporting or expanding tier, which is those that are trying to expand or export their promotional activities. And the last one, and it's really, I think I've heard diversification a couple of times today. The third tier is about expanding in a strategic shift in diversification, so new markets and new types of exporter customers for you. No doubt everyone in the last 2 years, and I'm still waiting for things to come from overseas, freight has been a massive issue with COVID. It's been, quite disruptive. So having the International Freight Assistance Mechanism, or IFAM, has been critical for Australia to ensure that we have both supply and exporters going on between us and our international bases. Minister Tian last month announced that the government will be extending this program with a further $260 million. It's run through Austrade, so you can get all that information on our website, and with a total spend of about $1 billion for that IFAM program. So it's one of the main ones that the government is seeing to ensure that our health supplies are getting where they need to get, and we're getting the supplies into Australia as well. We've got more than 13,000 flights since April 2020, and it's connected about 9 Australian ports to 58 international destinations around the world. Directly, it's supported 35,000 jobs, and indirectly about 120,000. So we're going to continue with that. We think it's a great program. And again, if you don't know about it and you're an exporter on the program or an importer, please let us know. The last one, which I'm personally excited about in the biotech area, is the IP patent box, a little off topic for the other programs, but the government is committed to biotech manufacturing as well in Australia. The IP patent box was announced in the budget this year with a $206 million scheme. It's there to reduce the R&D tax credits or tax on IP that is registered in Australia. So we are really encouraging businesses to have a look at that. The government is really committed to medtech and biotech manufacturing, and I think it's a great outcome. It's going to strengthen ties between Australia and China, and we really look forward to working with that scheme with the government and with our exporters. So Virginia, that's it for me, and it's lovely to see Amanda back, one of my co-collaborators.
Thank you very much. So just before I ask Amanda to continue, I just want to check with Anthony with your timing. I know you have another commitment this afternoon. I think you are still okay. We're a bit ahead of time.
Yeah, I'm okay to 3.
Okay, that's
Thank
great.
you.
All right. Well, then I may, if I could, Amanda, you were in the midst of telling us about the wonderful webpage or the report that you've done on the overview of 20 years of excellence on your webpage. Would you like to continue where you left off?
Thanks, Virginia, and my apologies, everyone. For the past couple of days, I've been having trouble with my connection, which has no pattern that I can observe, unfortunately. So, yeah, so I guess in summary, what I was saying is that if you're interested in understanding our 20-year journey of continuous investment in development of the biotech sector, I'm happy to put the link to the report online. And what it does is shows our strategic investment, where we've played, and really what we've achieved. What have we got for our investment? And that's the primary purpose of the document, to pause and reflect back on what has changed since we embarked on this endeavour. And in particular, one angle that we looked at is how that investment has helped us to deal with the current pandemic. And you'll see in there and examples of how the Doherty, for example, was the first institute outside of China to grow the virus. And the Doherty Institute, I'm sure, as all Australians know, and no doubt it's been well advertised around the world, have done incredible work in public health, in the public health response in terms of the epidemiology and the whole science and discovery of antivirals, vaccines, and measures that we all need to follow as we pursue a vaccination plus strategy as we go forward. But of course, the Burnett has had a long history with China and with rapid diagnostics and a whole range of other measures, both in infectious diseases such as coronavirus, but more broadly across the spectrum of diseases that are prevalent in China, hepatitis being one example where a substantial contribution and a partnership has existed between Victoria and China. Brett mentioned the Jiangsu arrangement. We've had a long-standing collaboration with Jiangsu province, and that's about co-investment in projects of common interest where there is genuine partnerships in China and in Victoria. So I think I might just leave it there for the moment, other than saying Brett also mentioned our offices in China. We've had that long-standing commitment to have a presence in market, which has really been invaluable in driving not only the Jiangsu, but other strategic relationships that we have with China. And just a big shout out to the 20 people that we have in market and to Brett Stevens, who's joined them to lead them to the next level. So they're a great network that support not only Victorian government to engage and develop partnerships, but of course our academic and industry network to facilitate those collaborations so that they can be expedited for the impact that we all intend for them to deliver. Thanks.
Thanks, Amanda. And we certainly are very fortunate to have those 5 Victorian government offices up in China. Nothing beats on the ground expertise. So thank you for highlighting that. And also thank you for mentioning the Burnett Institute's work, because we're very fortunate to have Associate Professor David Anderson speaking at in the next phase of the summit. So that will be good to look forward to. If I could perhaps then now turn to Anthony, your wonderful presentation. It's very emotive, isn't it? Nothing is more heartrending than seeing children, being cured, and the wonderful response of families. We know that the China market is important and will likely grow in stature relative to all other economies in the region, including Australia. What is your outlook for our economic future, given the current challenges to the relationship?
Yeah, it's a great question, and I guess to start, we'll let the politicians and the diplomats worry about the discussions that are going on at a national and a more local level, because we're committed to China, because we believe that the work that we do with children is universal. And I think someone mentioned earlier that healthcare is just an amazing space to be in. And so all of the discussions that we have today with the Chinese government at all levels, because we're so committed to helping China achieve health for its citizens, we do believe the outlook for our business in China is very, very promising. We're barely touching the surface, as I mentioned. Markets like Australia, we have penetration of children and children rates of cochlear implantation for those that need it are 99%. We have a lot to be grateful for here, as was mentioned, because of our clinical pathways and wonderful work that's been done over many years through Hearing Australia, through many charities and through all the state and federal government in hearing. And we now have a penetration rate of about 10% of adults in Australia who would benefit from a cochlear implant. They're people that go progressively deaf over time. So they get to a point where they are no longer able to hear speech and language when aided with a hearing aid. We have about 10% of those elderly Australians now have a cochlear implant. In China, it's 1% across the board. So we do believe the market is very, very promising. We believe that we can do more from a local research and development perspective. We will be putting people on the ground to help us understand things like tonal language. What are the differences in frequencies that relate to better outcomes for patients? We're going to be doing extensively more clinical trials. Hainan Island is a bit like the Greater Bay, presents a wonderful opportunity for our organisation because it has a regulatory pathway which is different. It enables us to get in products into China that we typically could not if we went through the traditional pathway. So we now, provided it has an FDA approval, a CE mark, a TGA approval, or Health Canada, we're able to get product onto that island. And we're actually going to be able to even do more. We can export product off that island onto the mainland. And the Greater Bay Initiative, which I'm sure David can share a lot more about, just shows opportunity will continue to grow. So we're very, very bullish about the future. We stay away from the politics. We just want to help Chinese people, like we want to help all people around the world, get access to the best life they can. And we're fundamentally believing that our commitment in building a plant, in having a direct presence, in really trying to understand the market so that it is really a multinational with a local flavour will put us in good stead. So I'm bullish about Asia Pacific and I'm bullish about Latin America, but I'm also just bullish about hearing in general. We play in a niche, but there is so much data coming out that the Chinese government's aware of, that the elderly with hearing loss present a huge issue in the future when it comes to Alzheimer's and dementia. And some of the work being done at Johns Hopkins, at Macquarie University, across the other side of Australia, at Ear Science with Marcus Atlas and others, it's just showing if you start looking at hearing loss and you modify it, whether it be a hearing aid or a cochlear implant, you can have a massive impact upon the downstream health costs. So I do believe we're there for the long term, and I think we're going to be terrifically supported. Dig Howard, our CEO, we're kind of pretty consistent. We let the politicians do their work, and our job is to build those business relationships. We still have terrific relationships on the ground with the different provincial and city Chinese officials, and we haven't seen any change in that.
That's terrific, and that's what David alluded to, though. The business-to-business, people-to-people relationships are so very, very important. They're long-term, long-established, and they are stronger than a lot of the ups and downs that happen within the political sphere. So thank you very much for that. Now, Amanda mentioned that the Victorian Government Trade and Investment Offices, and for those who are not aware, they're in Hong Kong, Beijing, Shanghai, Nanjing, and Chengdu, and Brett Stevens leads those up in China. So the question to you again, Anthony, is Chengdu. Why did you build your cochlear facility in that city?
Yeah, thank you, Virginia. I think it's a terrific question. And I think this comes down to really having the right partners on the ground for when you decide to do something like this. There is no doubt if all of us know China, you imagine Chengdu or Sichuan province is kind of in the center. There is a big move for from a Chinese government perspective to push more industry, more development, more universities out to the West. The central government's very, very committed to doing that. And it was requested that we move out to actually a new place next to Chengdu, purpose-built science and technology region that was mentioned earlier, called Tianfu New Area. It's going to house residential as well as industrial and manufacturing. It actually has its own purpose-built lake, which has a circumference of 10 kilometers. It's very important to President Xi, because he actually visited our site, which overlooks the lake. He actually came and stood on our site because it's got the best view of the lake. So we moved west because we were encouraged to by government. We were actually given terrific incentives to do so. And it's also, if you look at the number of university students, which is critical for a technology business like ours, the last data I looked at was 750,000 university students in Sichuan province at any point in time. So there's access to engineers, to doctors, to researchers. So we can build, if you've been to Macquarie University and seen the Australian Hearing Hub, we have a desire to work with the Chinese government and with other key players to actually build a facsimile of the Australian Hearing Hub so that we can start to build a great network of research, clinical investigation, and really start to have China having its own center of hearing research. It is different in China because of the way language is interpreted by the brain. So lots going on, but very, very excited. I mean, go west was the request, and we did.
Oh, terrific. And you did mention briefly, touched on China's health agenda plans. How does the Cochlear facility in Chengdu align with those plans? Have you done a specific project? Yes.
Yes, so we're doing more and more work. And I think the most important thing is you can't do this alone. So it's not a Cochlear story. It's really a story of hearing, and it's working with universities, the Australian government. We work closely, and I should have said this, with Austrade in Chengdu, and we thank them very, very much. And they help partner us with CEPA. And so all of this community needs to come together if you want to make systemic change in healthcare. You need to build from the ground up. So there are multiple universities in Australia. Cochlear is just, we're the manufacturer who can bring people together around a common cause, but we're working with many people to build this, because at the end of the day, hearing or disabling hearing loss, where it is severe to profound, so the person is deaf, is treatable if we get to people early, and if we make sure that that they're well looked after throughout their life. So if a child is diagnosed at birth, newborn hearing screening, give them a cochlear implant or a hearing aid, but in our case an implant, they can then attain normal speech and language. If a grandparent, my mother has high-powered hearing aids, as she gets older and she gets deafer, she'll need a cochlear implant. If we don't wait too long, she'll keep her hearing. And so this just it's such an easy story in this particular aspect, because the Chinese government gets it. They get that we've got to take care of children, and we also got to take care of the elderly. And so it's in some ways a privilege to be part of this, and privilege to be part of that broader network, working with Macquarie University, working with the Royal Victorian Ear and Eye Hospital, where the cochlear implant was invented. We work with University of Melbourne. We work with the University of Auckland. I mean, I could name 100 different universities that help us in China, because everyone sees the opportunity, and it requires a village to raise a new specialty, which is that treatment of really complex, severe to profound hearing loss.
Thanks, Anthony. Now, what I'd like to do is to ask our delegates on the line to think of any questions you would like and pop them in the chat room, because obviously we have very talented people here who would be very happy to help answer your questions. If you would like to find out more about export market development grants or any other aspects, please pop your question in the chat area. The other thing I would like to do is ask our panellists, if you have questions of each other, if you would like to think about anything you would like to ask your fellow panellists. And if I perhaps, while I'm talking about regions, we talked about Chengdu, if I could ask David, you are very much an expert on the Greater Bay Area of China, and if I could perhaps ask you a question in relation to the background on that ambitious Greater Bay Area project, and how businesses can leverage from the vibrant region.
Thanks, Virginia. I guess I'm an expert to the extent that I'm sitting up here physically in the Greater Bay Area. For some of you may not know, Hong Kong is actually part of the Greater Bay Area. I think most people tend to think of the Greater Bay Area as being Shenzhen, Guangzhou, and that sort of southern China region. There's 9 major cities there, but it also includes Hong Kong and Macau, which are the 9 plus 2 cities that make up this big mega region. It's now a region that has a population of about 70 million people. It's got a GDP of $1.7 trillion, so it's a little bit bigger than the Australian annual GDP. But the really fascinating thing is that you can get to every major city within the Greater Bay Area within 2 hours by fast train. And that's one of the key things. So this is an initiative. It's been around for some time under various names, but under its current guise for the last few years, the Greater Bay Area is essentially sort of an aggregation of major cities, each specialist in their own areas, but with a highly coordinated process to try and ensure that those cities work well together and that the economies are integrated over time. Now, that's there's a whole great story about all of that and plenty of opportunities, but to tie it into healthcare and health services from an Australian perspective, I think there's a couple of interesting examples that are worth noting. And that first point is Hong Kong's role in all of this. Hong Kong is emerging now as a really interesting place to set up for medical services, medical product businesses, because of its access into the Greater Bay Area. So a couple of recent changes. I think somebody mentioned this a little bit earlier about the harmonisation of laws. So certain medical products and services that are registered here in Hong Kong can now be offered freely into the Greater Bay Area. So that's particularly important for a couple of medical supply companies that I'm aware of that have operations here in Hong Kong. They've now got a market that's not just the Hong Kong market of 7 million people, but a market of 70 million people, 10 times the size, all within an integrated area. At an infrastructure level, policies are really being put in place that are really helping to drive all of this. One of the most interesting ones, which I don't think an Australian company has yet taken advantage of, but I'll give the example of Bupa. So they've set up a number of medical service centres in Guangzhou. Nothing unusual about that, growth of new service centres, but they've become the first foreign-owned enterprise to be able to qualify for direct reimbursement from the Chinese national health system for the services that they provide. So they're now integrated again into a 70 million people economy in a way that's fully aligned with China's long-term strategic health goals. So a risk minimization strategy in the right area, aligned with government policy, as is Cochlear. Really interesting. And just one more example, just around the infrastructure that's going on here. Members and guests may have heard about Stock Connect and Bond Connect and Wealth Connect in the Hong Kong China context. That's for the free flow of capital across borders. But there's now the interesting Insurance Connect. So insurances, including medical insurances, can be offered by Hong Kong or Australian companies through Hong Kong into the Greater Bay Area. Seamless service, and similarly those residents there can buy products in Hong Kong. So it's an integration of markets, really worth looking at. Not everybody can spend 20 years now to develop their markets in the way in which Cochlear has done. For new entrants, getting good advice from Invest Victoria, Austrade around market entry locations is worthwhile, and you should definitely have a look at Hong Kong as a stepping stone into those markets.
Thanks, David. That's very valuable. Now, we do have a question from SJ Chen coming through for Regina. It's in relation to Austrade's grants to support Aussie biotech and collaborate with China. Do the grants support and include research and development, clinical trials, etc.?
Thanks for that, Virginia. And I knew I was going to be asked the only question that I didn't know the absolute answer to. So I've desperately just quickly tried to look. My recommendation would be there are very clear guidelines on the Austrade website, and I'd go to the grant portal, and that will take you through it. They are very clear, but they are specific. So you just need to, I don't want to give you incorrect advice here. So I think just take yourself through those and reach out to your Austrade office closest to you if you need any further advice. We're there for you.
Terrific. Now, do the panelists have any questions of each other while we're going? Did anyone? Oh, I heard Jason's son, I think, has come on live. Jason, do you have a question?
Yes, I do actually. Thanks very much for the discussion from all the panelists and presentation from Anthony. That was very interesting. Thank you. So the question direct to Regina and David. Regina, you from Austrade, obviously you have your ears to the ground, as well as David now position himself in the Greater Bay Area. Did you sense there's a changing attitude of Chinese business or Chinese individual wanting to do business in Australia? If so, how much is that change? Whether any advice on how to engage if there is a negative change? Thank you.
Would you like me to take that one first, Virginia? Yeah, so thank you very much. Actually, as I mentioned in my opening remarks, we're not actually seeing a negative change at all. I think it's been a fantastic outcome, really, considering what's gone on in the world and the disruption with freight and all the other things, and all the other things that are going on. I think, and it's previously been mentioned, two of the big areas where we're seeing an uptick, and Rhett Miller, our Trade Commissioner, is in the next panel session and he can take this on further. But in those health services and in aged care, there's a significant amount of trade and investment going between those two areas. And I must say, I've got a little hand on heart because I come from a group where I oversaw the complementary medicine group at RMIT for the last 2 years. And so, those complementary medicines, we can learn a lot from each other in that area, and that's another area that I think we'll see a lot of increase in both trade and investment in those areas. And of course, what we're seeing with the Australian government in trying to increase biotech and biomed manufacturing, we're certainly looking at that with the dual lens of both China and Australia to see how we can provide complementary increases in the supply in those areas.
And just to add to that, Jason, I think Regina sort of answered that very well. There is no real evidence of investors or traders from China wanting to turn away from Australia. Certainly there's concern, people ask questions. I think if anything, it's the major state-owned enterprises that are the ones that may not be as active in our markets, the Australian markets, as they have in the past. They're not necessarily the players that a lot of the this sector is working with. So certainly at the entrepreneurial level, the innovative companies, the private companies, there's an enormous amount of interest in Australia, and particularly in this sector. It's seen as such an important sector. It's important for China, but it's also important globally. And I think that's the point that we need to continue to focus on. We just need to work with all of these people and find the opportunities to engage in the right way, in the right areas.
Anthony, did you have any comments in relation to that?
No, I think it's been really answered well. It's obviously a complex conversation, but I do think Jason, I do think it's a great question and something we continually think about. Nothing to add.
That's great. It's nice actually to think in terms of health diplomacy. We talk about cultural diplomacy and we talk about sports diplomacy, and we think about health diplomacy. That's a very, very strong platform for engagement. So thank you to our very, very talented panel of speakers. It's been delightful having you contribute to this really important conversation. We are now a little ahead of time, but sorry, we have one more question. I have a message coming through. Is everything happening live? No, it's not coming through. So I might close the session now and let everybody know that we will have a break. We will come back for phase 2. You can start logging in at about 3 o'clock and the session will start at 10 minutes past 3. The link has been sent to you in your email earlier this morning, and it'll be in your inboxes in a reminder email as well, sent in a moment. And any queries, please contact zach.eggleston@acbc.com.au, and you should have lots of emails from Zach. We'll see you soon for an exciting presentation from the Burnett Institute's Associate Professor David Anderson, who will discuss the good, the bad and the insights based on his organisation's long-term engagement with China. So for now, I'll bid you fond farewell, thank our speakers once again, and look forward to welcoming everyone back at 3:10. Thank you so much.